When we made the transition to ESO, we were using a fairly cumbersome product. I needed a clinical quality product, something that allowed our paramedics and EMTs to record patient care data, which they were being asked to present more and more about, is how are we taking care of patients and how are we doing that effectively.
Our transport provider is San Marcos Hays County EMS, and we utilize it hand in hand with those guys. Whenever we ever arrive first and take patient care, we're able to provide data collection and pass it on to them with the data transfer. And then on the fire reporting, we use it every day to collect the data that we're needing for the fire reporting.
Our firefighters are on the front line of EMS and suppression calls. Our number one way to receive information about those folks that are the most vulnerable is to get it from our providers and responders.
Thinking about the welfare of your people is critical, and being able to track that kind of data and knowing we can pull it up at any given time and see what our guys have been exposed to.
Fire trends is always interesting to watch, especially as we try to see kind of where the fire service is going as well, and how do we compare to other departments, and are we seeing the same challenges? I mean, our information goes into that report.
We're one of the fastest growing counties in the nation. In our organization, we're utilizing the data that we're collecting to drive some of our decision making.
And if we're going to take care of our citizens, I mean, we're part of that. And so that's part of that future component of what's happening in our community. It's part of how we educate our members to enter better information and demonstrate the value of good information. And so it's part of the fabric of the department.